Hi, this is Dr. Antolak. I just wanted to explain a little bit about when we get a patient in and whether to find out if they're a candidate for a dental implant or not. And maybe I wanted to also show some of the areas that we have to be concerned about. And this is the benefit of doing a three-dimensional, it's called a cone beam CT scan. So it's a CBCT. And what it does, it's a three-dimensional scan, low radiation, which gives us the ability to extremely accurately place, virtually do implants and find out what some of the areas, the vital areas of the jaw are, and of the sinus and everything else. So I have a patient here who I saw, and I'm planning on doing surgery on her soon. And I just want to kind of go over some of the details of this, okay? So what I have here is, this is the skull, basically the skull, different views here. But we have dental implants that would go into, I have planned to do 4 implants on the top, 2 on the upper right side, 2 on the upper left side, and then 2 over on this region over here, and then 1 over here eventually. And for this patient, I just want to just show you that this is, we can put virtual implants in and we can take them, move them around a little bit and things like that, okay? So, but what I do want to do is to show you that in this situation, for example, where this implant would be right here, this patient has extremely little bone, about 2 millimeters of bone right in this region here. It's obviously not enough room right there to place an implant in. This would be a virtual implant that is, I think, around 10 millimeters long. And so therefore we have a lot of sinus. This is the actual sinus. So it's sitting right in this region here. That what we're going to do is we're going to go through and we're actually going to place a sinus graft where we go underneath and we tease this tissue out. We put it with cadaver bone and we fill in a large area of where the sinus is in this region here. And then when we carry that back further backwards, and then we also lift that membrane up and place that grafting, and it's done basically right through the side. It's a lateral approach, we call that. And so we do that in both sides, the right side and the left side. But before we can put the implants in, we have to place this bone in so that it integrates in and becomes like her own natural bone. And therefore then we can actually place an implant in that region there. For her lower, and I just show this as a demonstration, this red line is where the lower jaw, if you've been numbed up before on the lower, then that's the area that we go for, and we numb that area up, and that goes right through the jawbone here. This is a vital area that we always have to be concerned about whenever doing a lower implant, especially, and even wisdom teeth, that when we extract a tooth or place an implant, we don't want to get near this region here too closely, because if we do, then that will lead to further complications in that area there. So basically this shows here, this is the lower left-hand side. She's got some teeth that are bad, and this black area is an infection, so we have to take that tooth out. We'll put an implant in, and we'll immediately after extracting the tooth, and then we'll give that time to heal. This red here, this little red dot right there, shows where that is in that region there. And we can kind of see even on the top where the sinus is here, and this outline is where the upper implant would go. And we can kind of see as we drag this through what it would look like from this region. We can see right where that nerve would go right through here is an area that we have to be obviously concerned about. But in this case, that's pretty deep down, so it's not really too much of a concern. But we always outline these out and then show our patients. So if you have an interest, or if you're dealing with missing teeth and you're kind of tired of what that is like and how that feels with biting and chewing, and not being able to chew the foods you want, and getting stuff stuck in there and it irritating the gums, or if you have like a partial denture you're wearing, you're not happy with that. There's so many other alternatives. This has been our primary way that we're replacing teeth nowadays. Not with removable devices, even not with what's called a fixed bridge, where we have to grind on both sides of teeth and then wear those down too. But this is a great way of really taking care and replacing teeth on a one-on-one basis. Even if it is involved with the sinuses, this is something that we do, and it's very beneficial. You can give us a call. We can talk about it. If you have a scan like this, we can do a free consultation for you. We can have you come in and we can take a scan and just talk about the options for you. So our phone number is 586-247-3500, and we're glad to see you. God bless you.